So here we are with the second installment of our general principles, pharmacodynamics. First key point, some definitions. We know pharmacodynamics deal with interaction with receptors and drug responses. There are two broad families of drugs out there, what we call an agonist and what we call an antagonist. An agonist is a drug which binds to receptors. Binding, we say, having affinity for that receptors. Agonists, thanks to their affinity, thanks to binding to a receptor, will result in a response. The measuring of responses is what we call the efficacy of a system. So agonists are drugs that would have both binding capacity, affinity, and eliciting responses, they have efficacy. Contrast this to what we call an antagonist in pharmacology. Antagonists still bind to receptors. Therefore, antagonists, just like agonists, have affinity for receptors. They bind to these targets, recognize them. However, the key difference between an antagonist and an agonist is at the level of responses. If an agonist gives a response, has efficacy, an antagonist, by definition, is not associated with a response. An antagonist has zero efficacy. This sometimes is counterintuitive. Very often, in medicine, we'll be thinking, oh, an antagonist causes the opposite response to that of an agonist. It is wrong to think about it this way. And you'll see that in our first very important section of pharmacology per se, not general principle, the section we'll call autonomic nervous system. This will be a spot where agonists and blockers, agonists and antagonists of receptors are going to show you exactly what these definitions mean in detail. So for right now, know that agonists and blockers have affinity, but whereas an agonist gives a response, an antagonist does not. It prevents responses. By definition still, therefore, what do we call affinity? We kind of already had to use the parameter of affinity in talking about binding. Indeed, affinity is the ability of a drug to bind to a receptor. Essentially, imagine a chemical having a certain shape, and therefore recognizing where to bind to based on that shape. You know, a classic analogy in pharmacology, biochemistry, is to think of a key lock type of configuration. A drug has a certain shape, and a receptor has the complementary shape for that drug to fit in that pocket. Well, that interaction with the receptor is thanks to binding characteristics. That's what we call affinity. A key issue is that it is not because you bind to a receptor that you will cause responses. We just saw how agonists would result in responses, antagonists wouldn't. And the measure of responses in your definition is called efficacy. It's the measure of how well a drug produces a response when it binds to a receptor. Efficacy is a parameter that is measured for agonist type of drugs. Antagonists have zero efficacy. So a final definition, which sits here in the middle between affinity and efficacy, is the parameter of potency. Potency is a comparative measure. It's something that you would look at when you have several agonists and you want to figure out how much of that agonist should I use in order to get to a certain size response. Certainly the one drug you would use the least of to reach that response must be the most potent drug. So potency shows the relative doses of two or more agonists to produce the same magnitude of effect. Do notice how we stayed away from defining potency for a 50% response, which is often used in books. However, you know as well as I do that you don't only measure drugs based on 50% responses. Example, I don't think it would be the best thing in your life to do general anesthesia with a dose of drug that would result in 50% anesthesia in a patient, since likelihood is you would get a big smack in your face as soon as you would start using your scalpel. Same token when you try and treat blood pressure. Maybe in some patients you may need to cut their blood pressure literally by 2. But in others, you may just want to remove a few millimeters of mercury. So potency, its best definition is as written here in your Kaplan syllabus. The relative doses for a certain magnitude of effect.